11 Pancreatic cancer symptoms you must pay attention to. When we think of pancreatic cancer, it's easy to overlook its symptoms. Often called the silent killer, this type of cancer can progress undetected for months, sometimes even years. But what if I told you that there are early warning signs that many people miss? These signs could be your body's way of trying to tell you something important before it's too late. In this video, we're going to talk about 11 critical symptoms of pancreatic cancer that you absolutely cannot ignore. Stick with us, because we'll also dive into 3 unusual signs you probably haven't heard of before. Understanding these symptoms might just make the difference between early detection and a missed opportunity for life-saving treatment. Let's start with the first sign you need to be aware of. 1. Itchy skin, an early, overlooked sign. One of the most frustrating and confusing symptoms of pancreatic cancer is itchy skin, a symptom that many might ignore or attribute to something less serious, like allergies or dry skin. Medically known as pruritus, this itch is often associated with jaundice, which is a yellowing of the skin and eyes. But what causes this intense itching? It's all about a bile duct obstruction caused by the tumor. When the pancreas is affected by cancer, a tumor can block the bile duct, preventing bile from being properly drained into the intestines. This blockage results in bile acids and bilirubin, a yellow pigment, accumulating in the bloodstream, which, when deposited in tissues like the skin, causes itching. The sensation is not like the mild, temporary itching you may experience from seasonal allergies. It's deep, persistent, and can feel almost unbearable. For some, it starts as a mild irritation but intensifies over time. What makes it even more concerning is that the itch can appear before the yellowing of the skin or eyes becomes noticeable. So why is this important to recognize? If you've been experiencing this type of relentless itch, especially on the palms of your hands or soles of your feet, it could be an early clue to an underlying problem, such as pancreatic cancer. And while typical antihistamines or lotions may not provide any relief, seeking a diagnosis sooner rather than later could make a big difference in the outcome. 2. Unexplained bloating, the silent red flag. Many people dismiss bloating as just another sign of indigestion, but if you notice unexplained bloating, especially if it doesn't go away or worsens over time, it could be indicative of something much more serious, like pancreatic cancer. The reason? Pancreatic tumors interfere with the digestive process and can cause discomfort due to the way food moves through the gastrointestinal system. The pancreas is deeply involved in digestion, and when a tumor grows in this area, it can obstruct the movement of food and fluids. This could lead to a sensation of fullness in the abdomen, even after eating small amounts of food. And this is no ordinary bloating, it's persistent and tends to stick around no matter what remedies you try. It's often accompanied by a loss of appetite and, ultimately, weight loss. There's also the possibility that this bloating could be related to ascites, the accumulation of fluid in the abdomen. In some cases, pancreatic cancer can spread to the peritoneum, the lining of the abdominal cavity, causing irritation and stimulating fluid buildup. This condition can make the abdomen visibly swollen and distended, and the discomfort may even limit mobility or interfere with daily life. If you're experiencing bloating that isn't relieved by common remedies like antacids, coupled with unexplained weight loss, it's essential to talk to your doctor. Early detection of any tumor-related blockages or fluid buildup can significantly improve outcomes. 3. Persistent lower back pain, not your average ache. Lower back pain can affect anyone, especially those with poor posture or those who have been on their feet for a long period of time. But when back pain becomes persistent, deep, and unresponsive to regular pain relief methods, it could be a sign of something more concerning, like pancreatic cancer. Unlike typical back pain caused by strain or muscle injury, the back pain associated with pancreatic cancer tends to be dull and aching, and it may radiate to the back from other areas. Why does this happen? The pancreas is located deep in the abdomen, close to the spine. As a tumor grows, it can press on nearby nerves and organs, leading to pain. Specifically, the cancer can compress the celiac plexus, which is a collection of nerves that supply the upper abdomen. The result is discomfort in the lower back area, which can worsen after eating, lying down, or even during the night when the body is at rest. For those with pancreatic cancer, the pain doesn't go away with common remedies like stretching or massage, and it may become more intense when lying down or after meals. If your back pain doesn't respond to regular treatments and seems to intensify over time, it may be time to talk to a doctor. 4. Sudden mood changes and depression, an often overlooked clue. It's easy to overlook sudden mood changes when they seem unrelated to a physical condition. Depression or feelings of hopelessness often arise without warning, and these mental health shifts can be more profound than what you might experience during a period of stress. But, when depression strikes suddenly, especially without any obvious emotional trigger, it could be an early symptom of pancreatic cancer. The connection between pancreatic cancer and depression isn't entirely understood, but one potential reason is the way tumors affect your body's hormonal and immune systems. The pancreas plays a key role in producing hormones like insulin and glucagon, which regulate your blood sugar levels. Cancer in the pancreas may disrupt the balance of these hormones, creating metabolic changes that affect brain chemistry. Additionally, as the body reacts to cancer, the immune system produces cytokines, proteins that help control inflammation. These substances can impact mood and behavior, sometimes leading to depression and anxiety. Moreover, certain neurotransmitters involved in mood regulation may be altered, either by the cancer itself or its treatments. If you suddenly feel more anxious, sad, or hopeless, especially if it's not typical for you, it could be worth exploring further. Emotional changes could be your body's way of signaling that something isn't quite right. 5. Unusual changes in taste, a subtle symptom. You might be surprised to learn that changes in taste, like a persistent metallic taste in the mouth, could be a clue to something serious. People with pancreatic cancer often notice this subtle change, which may make eating uncomfortable or unpleasant. This change in taste is thought to result from metabolic changes caused by the tumor or even as a side effect of treatment. When pancreatic tumors disrupt the body's digestive processes, it can lead to a buildup of certain byproducts in the bloodstream. These substances can affect taste receptors and cause that weird metallic sensation. Chemotherapy treatments can also exacerbate this issue, as they can alter taste perception further. In addition to the metallic taste, some people notice a reduced ability to enjoy food. Things they once loved may now taste bland or unappetizing. Over time, this can lead to a significant loss of appetite, which, if left unchecked, could contribute to unintentional weight loss. If food no longer tastes the way it used to, or if you notice a strange, persistent taste, it's worth considering this as a possible warning sign. 6. Unexplained fevers, the body's defense mechanism. Unexplained fevers, especially those that persist or fluctuate over time, can indicate that something more serious is happening. Pancreatic cancer disrupts the body's immune system in complex ways, often triggering a systemic inflammatory response. This is the body's attempt to fight the cancer, which leads to the release of cytokines, inflammatory proteins. These cytokines can cause fever, even in the absence of an actual infection. While most people associate fever with illness, a low-grade fever that doesn't go away after a few days or keeps coming back could signal that cancer is affecting the body's immune response. In addition to fever, pancreatic cancer can impair the body's ability to fight infections, leaving patients more susceptible to frequent illness. If you find yourself consistently battling low-grade fevers or feeling unwell for no apparent reason, it's essential to consult with a healthcare provider. 7. Swelling in the legs, a sign of blood clots. You've likely heard of swollen legs from standing too long or after a long flight, but swelling in the legs, especially if it's localized to one leg, can be a sign of deep vein thrombosis, DVT, a serious condition often associated with pancreatic cancer. In fact, pancreatic cancer increases the risk of blood clots due to its ability to affect the body's blood clotting mechanisms and its systemic inflammatory response. Cancer-related blood clots can be very dangerous. The affected leg may feel tender, warm, and swollen, and could be accompanied by a discoloration. If you're experiencing these symptoms and don't have an obvious explanation, it's important to seek medical attention right away. 8. Difficulty swallowing, a troubling sign. When it comes to swallowing, we don't usually think too much about it. But if difficulty swallowing, known as dysphagia, becomes a problem, it can be more than just an inconvenience. For individuals with pancreatic cancer, tumors can cause complications in the digestive tract that lead to swallowing difficulties. Pancreatic cancer tumors can grow and press on surrounding structures in the abdomen, including the esophagus, the tube that carries food from your mouth to your stomach. This compression can narrow the esophagus, making it harder for food or liquids to pass through. At first, you might notice it's harder to swallow solid foods, but as the cancer progresses, even liquids can become difficult to manage. Some people describe it as feeling like food is stuck in their throat or chest, or even feeling choking sensations while eating. This sensation can cause individuals to avoid eating altogether, leading to unintended weight loss and even dehydration over time. If this is happening to you, especially with other warning signs, it's critical to seek medical attention. Not only is this a sign of a potential blockage, but it's also a reflection of the growing presence of the tumor, affecting other vital organs and systems. 9. Persistent abdominal pain, a deep warning signal. Abdominal pain can be a symptom of many things, but persistent pain in the upper abdomen, radiating to the back, could be a sign that pancreatic cancer is at work. This pain is often not like the occasional stomach ache we all get after a large meal. It's deep, nagging, and unrelenting. And here's the kicker: it often gets worse after eating or lying down. Why is this? The pancreas is positioned deep in the abdominal area, near the spine. As the tumor grows, it can press on nearby organs or nerves, causing discomfort. The pain is often described as a dull ache, but it can feel more intense if the tumor presses on the celiac plexus, a group of nerves responsible for the upper abdomen. For many people, this pain becomes worse after meals, as food stimulates the pancreas and increases pressure in the abdomen. If you've been dealing with abdominal pain that doesn't seem to go away with typical treatments, like antacids or pain relievers, it's something that requires attention. In the later stages of the disease, this pain might become more intense as the cancer spreads to other organs, so don't dismiss it as just an upset stomach. 10. Nausea and vomiting, digestive disruption. Nausea and vomiting are classic symptoms that can indicate a range of health issues. For individuals with pancreatic cancer, these symptoms arise due to the tumor's interference with the digestive system. The tumor can block the normal flow of food and fluids through the stomach and intestines, resulting in that uncomfortable feeling of nausea, and in more severe cases, vomiting. The tumor can also disrupt the normal functioning of the pancreas, which plays a key role in digestion by secreting enzymes that break down food. When the pancreas is compromised, food doesn't get digested properly, leading to nausea and vomiting. These symptoms are often more pronounced after eating, and sometimes, the body might refuse to process food altogether, resulting in weight loss and malnutrition. If you've been feeling nauseous regularly, or if it's associated with vomiting after eating, it's time to consult your healthcare provider. These symptoms, when paired with others like abdominal pain or unexplained weight loss, could be a sign that something more serious is at play, like pancreatic cancer. 11. Changes in stool, a key indicator. Lastly, one of the more overlooked symptoms of pancreatic cancer is a change in stool. Have you noticed your stools becoming greasy, pale, or with an unusual, foul odor? This could indicate that the pancreas is failing to produce the necessary digestive enzymes that break down fats. Without these enzymes, your body struggles to absorb fats from food, resulting in fatty, smelly stools that may float in the toilet. This is called steatorrhea, and it's an important clue that your pancreas isn't functioning properly. You might also notice that your stools are unusually light-colored or clay-colored, another indicator that bile flow is obstructed. These changes can be due to a blockage in the bile duct, which prevents bile from reaching the intestines. This is typically a result of a growing tumor in the pancreas. If your stool is changing and you're also experiencing other symptoms like unexplained weight loss, pain, or nausea, it's time to see a doctor. Changes in stool are a clear sign that the digestive system is being affected, and prompt medical intervention could help manage the issue. Early detection, the key to better outcomes. Pancreatic cancer is notoriously difficult to diagnose early because it often doesn't show symptoms until it's in more advanced stages. But the reality is that the earlier you catch it, the better your chances for successful treatment. The key here is awareness. These 11 symptoms, though varied, are all signs that your body is trying to tell you something. They shouldn't be ignored, especially when they persist over time. It's easy to brush off minor health issues as something temporary, but if you experience a combination of these symptoms, itchy skin, persistent back pain, bloating, changes in mood, or even unusual taste changes, it's important to be proactive and see your doctor. Early detection, even though challenging, can significantly improve the success rate of treatments like surgery, chemotherapy, and radiation. By recognizing these warning signs early and seeking medical advice, you're giving yourself the best possible shot at getting the right diagnosis and beginning treatment as soon as possible. Pancreatic cancer is one of the deadliest cancers out there, but with the right information and early intervention, there is hope. Pancreatic cancer might not give you obvious warning signs, but now you know that there are subtle, yet crucial, symptoms that can help you recognize it early. Itching skin, unexplained bloating, persistent back pain, and mood changes are just a few of the signals you should never ignore. If you or someone you know is experiencing any of these, don't wait, seek medical attention as soon as possible. Early detection is key to improving your chances of successful treatment. I hope this video has shed light on the signs you need to be aware of, and remember, taking action early could truly make all the difference. Stay healthy, stay informed, and take care of yourself. Thank you for watching, and don't forget to like, share, and subscribe for more insightful content.